Pedophilic disorder represents one of the most complex and challenging conditions within the field of mental health, requiring careful clinical understanding and evidence-based approaches to assessment, treatment, and prevention. This disorder is classified in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, as a paraphilic disorder characterized by recurrent, intense sexually arousing fantasies, urges, or behaviors involving prepubescent children, typically age 13 or younger, experienced by individuals who are at least 16 years old and at least 5 years older than the child or children involved. The diagnostic criteria for pedophilic disorder require that these sexual attractions have persisted for at least 6 months and have caused clinically significant distress or impairment in social, occupational, or other important areas of functioning, or the individual has acted on these urges with a child. Mental health professionals emphasize the crucial distinction between having pedophilic attractions and acting upon them, as not all individuals with this condition engage in harmful behaviors toward children. This distinction is fundamental to understanding both the clinical presentation and the therapeutic approaches used in treatment. Research into the etiology of pedophilic disorder suggests a multifactorial origin involving biological, psychological, and social factors. Neurobiological studies have identified potential structural and functional brain differences in individuals with this condition, particularly in areas associated with sexual behavior regulation and impulse control. Some research indicates possible developmental factors, including head injuries during childhood, hormonal influences, and genetic predispositions. However, the scientific community continues to investigate these potential causes, and no single factor has been identified as definitively causative. From a clinical perspective, the assessment of pedophilic disorder requires specialized training and comprehensive evaluation methods. Mental health professionals utilize various assessment tools, including clinical interviews, psychological testing, and sometimes physiological measures, to accurately diagnose and understand the individual's condition. The assessment process must carefully distinguish between pedophilic disorder and other conditions that might present with similar symptoms, such as other paraphilic disorders, substance use disorders that might lead to impaired judgment, or antisocial personality disorder. Treatment approaches for pedophilic disorder typically involve multiple therapeutic modalities designed to help individuals manage their condition and prevent harmful behaviors. Cognitive behavioral therapy forms the cornerstone of most treatment programs, focusing on helping individuals recognize and modify thought patterns and behaviors associated with their condition. These therapeutic interventions often include relapse prevention strategies, social skills training, and techniques for managing sexual urges in healthy ways. Pharmacological interventions may also play a role in treatment, particularly for individuals who struggle with impulse control or who have acted on their urges. Selective serotonin reuptake inhibitors, SSRIs, are commonly prescribed to help reduce sexual urges and compulsive behaviors. In more severe cases, anti-androgen medications might be considered to reduce testosterone levels and thereby decrease sexual drive. However, medication is typically used as an adjunct to psychotherapy rather than as a standalone treatment. The role of support systems and specialized programs cannot be understated in the comprehensive treatment of pedophilic disorder. Many treatment centers offer group therapy sessions where individuals can discuss their experiences and challenges in a controlled, therapeutic environment. These programs often emphasize the importance of developing healthy coping mechanisms, building appropriate social relationships, and understanding the severe harm that can result from acting on pedophilic urges. Prevention efforts represent another crucial aspect of addressing pedophilic disorder at a societal level. Early identification and intervention programs aim to help individuals who recognize problematic attractions before they engage in harmful behaviors. Some initiatives focus on providing confidential resources and treatment options for individuals who seek help voluntarily, recognizing that shame and stigma often prevent people from accessing necessary mental health services. The legal and ethical considerations surrounding pedophilic disorder are complex and vary significantly across jurisdictions. Mental health professionals must navigate mandatory reporting requirements while maintaining therapeutic relationships with their patients. The challenge lies in balancing public safety concerns with the need to provide effective treatment that encourages individuals to seek help and engage honestly in therapy. Research continues to evolve in understanding pedophilic disorder, with ongoing studies investigating new treatment modalities, risk assessment tools, and prevention strategies. Virtual reality therapy, mindfulness-based interventions, and enhanced cognitive behavioral techniques are among the innovative approaches being studied. The scientific community emphasizes the importance of evidence-based practices and the need for continued research to improve treatment outcomes and prevention efforts. Public education about pedophilic disorder remains essential for reducing stigma while maintaining appropriate protective measures for children. Understanding this condition from a clinical perspective helps inform better policies, treatment programs, and prevention initiatives. Mental health professionals stress that effective treatment and prevention require a balanced approach that prioritizes child safety while recognizing that individuals with this disorder can benefit from appropriate therapeutic intervention and support.